Sure that I introduce them correctly. On my left is Claire Richmond, Project Manager of the Healthy Homes Des Moines, and Marcy Cordero, Director of Health Services for the Des Moines Public Schools. Nice to have you both here. And
thank you for being here.
Jump right into Healthy Homes and what Healthy Homes is all about, Claire.
Sure. So we're looking at minimizing rates of asthma in the children in our city. We're a huge collaboration of partners that are all working to do this, and we can actually get into the homes of children who are sick and look at what's causing the asthma itself. So we work with all three big medical systems in Des Moines, Broadlawns, Mercy, and Unity Point, and then we have a huge collaboration of community partners, including the Polk County Housing Trust Fund, Visiting Nurse Services, Des Moines Public Schools is one. Who am I missing? The Polk County Public Works, the Mid-Iowa Health Foundation, Viva East Bank is a huge partner. Lots of people involved.
I love this idea because if you're diagnosed with having asthma, a lot of times you might, be thrown an inhaler or told to, watch out for certain activities, but you don't always think about things you can do at the home to help prevent that. And Marcy, you're kind of at the forefront of seeing if kids are up for being referred to this program.
Right. We have a great number of students in Des Moines Public Schools that have a diagnosis of asthma, and so the nurses are always being on the lookout to see what precipitating factors are and what triggers there are for these children that can cause asthma flare-ups and illnesses, and so we're a good referral source for this program.
Okay, so what are things we can do in our home? I'm sure parents are hearing this and it's like, wait a minute,
yeah.
What can I be doing on a daily basis to maybe helping out my child?
Keep your place clean.
Clean, that's the biggest thing.
Yes, pests are a trigger, so cover your food, cover your garbage. Take care of those pests, but also don't use a lot of chemicals when you clean. So that is kind of a nice lead into our little healthy cleaner bottles that I brought along here. This is an example of something you can actually clean with vinegar and water.
Here, so go ahead and set that down and show that camera right there, and we'll be able to show exactly what we're talking about. So you're saying basic things that we have around the home can do just as good of a job as opposed to using those harsh chemicals around the house.
Right, exactly.
So where can I use 1 part water, 1 part vinegar around the home? What would that be doing for me?
It's just kind of an all-purpose cleaner.
It is, okay. Good to know.
So do you provide folks to go in and take a look, or is it that you're helping by sending materials home with the kids?
We do both of those things. So when we get a referral of a child, we actually send a community health worker and a healthy homes inspector from the health department to look at the home itself and to talk to the family, learn about their medical history, learn about what some of the allergies the child might be experiencing, and then the healthy homes inspector looks at the actual house, the structure, if there's really old carpet that could be replaced, things like this.
Asthma seems to be just proliferating. Why is that? Is it a different environment? How do you diagnose and know?
You're right, it is. We have about 10% of our students that have a diagnosis of asthma, so it is. And I couldn't tell you what is leading the increase, but there definitely is one. So there's a lot of kids, and it varies from real mild to more severe. Some kids can manage it quite well with inhalers, but some of them can get very, very ill. And so anything that we can do in the home to help alleviate any of those triggers is certainly beneficial.
Is there something specifically you spot when you're thinking or walking down through the halls of the schools to say, wait a minute, that sounds like it might be the start of asthma?
A lot of times you can just tell from the breathing, like it's loud, wheezy breathing, but sometimes it can be, you can't tell at all, and the students can just kind of self-regulate and they know when they're having some trouble. Sometimes they know that there are activities like PE or going outside for recess that they know can cause little flare-ups, so they usually monitor pretty well.
And have you seen an improvement since working with Healthy Homes?
Well, we're just starting working with them, so we're certainly going to be monitoring that and sharing data to keep track and see what kind of benefits we can get from this program.
So let's say someone's watching and they have a kid, a grandkid, someone they're taking care of, and they would like to find out more and do something to make sure that they have someone give them some ideas. Where do you contact? How do they get a hold of you, knowing that it's just getting together?
Go to healthyhomesdesmoines.org.
So you don't need to be referred. You could just go to the website.
Well, go to the website for more information. Okay. You do need to be referred to the program.
And do you guys help out financially if it is a situation where they might need new carpet or something like that?
We are, yes, totally funded for eligible children.
Okay. So if you want to make a difference and help in the health of your child, this is something you definitely want to check out. And do you recommend parents making sure that they have that conversation with school nurses so they know exactly what's going on?
They should start with their primary health care provider, but the school nurse could help them kind of make a referral to a primary health care provider if they don't have one. So the nurse could be a partner in that effort.
Okay. Keep that conversation going, folks, and know that there is help out there to make sure our kids are having great lives. Wonderful. Thank you, ladies, so much for joining us
you
this
so much.
morning. And get more information, folks. We want to make sure everyone has healthy homes and healthy kids.